Sources told me this morning that we've now hit a tipping point when it comes to the outbreaks we're seeing in the aged care facilities in Victoria. It was described as a significant lift now in these facilities. When we look at the new numbers today, 63 aged care facilities have now been impacted by coronavirus. When you break that down, that includes 54 residential homes. In those 54 residential homes, 170 residents have coronavirus. 146 staff members also have coronavirus. 9 extra in-home care services have been impacted. That includes 4 recipients of care, so 4 older Australians, along with 6 staff members. Now, just a few days ago, authorities were telling us that the staff infections were the real problem. That's now changed. This has now spread so rapidly that there are now more residents infected than staff members, and the infection rate among those residents is obviously particularly worrying. We know that older Australians in these homes often do have comorbidities. They are particularly vulnerable. Currently, the state government health authorities are making a case-by-case assessment as to whether or not a resident who tests positive needs to go straight to hospital. Aged care providers have been really pushing the government to change that. They want any resident who tests positive with coronavirus to be transferred to hospital immediately. The Aged Care Guild acting CEO Nicholas Brown has made the point that these residential facilities are not hospitals, they're homes, that they're not set up for the level of isolation or the acute care needed to manage a COVID-19 outbreak. Now, yesterday I spoke with the Aged Care Minister Richard Colbeck about some of these issues, and I asked him why the government isn't moving to change that, why they're not wanting to get these residents out of the impacted homes and into hospitals as soon as those cases are recorded. This is what he had to say.
Some of them might want to go to hospital, some of them clinically won't need to go to hospital. We need to make sure that the capacity in the hospital system remains there to take those that genuinely need it, and those that genuinely need it should and will go to hospital.
And the Health Workers Union also hasn't been happy with some of the moves we've seen to limit aged care workers from just working in one facility. We know that workers in Victoria who are being stopped from going to their second or perhaps third jobs are being given some cash payments to help them on that front. But I asked the Minister if he is looking at a Commonwealth level to change that, to make that a blanket rule that workers can't move between these facilities, because we know that that has been a source of some of the spread. He said that he's trying to avoid making that a mandate, essentially, that he's working with these aged care homes, with these aged care providers to try to stop workers moving between them, but it's not something he wants to make a hard and fast rule. Have a listen.
We're working with the sector, knowing how complex it is, so that they can work out the industrial relations arrangements between them, the unions and their workers. But we're very cognizant of the fact that we need to make sure that the workers aren't worse off financially. We're prepared to put some financial support on the table to assist with that, but we don't think it's desirable that it be a mandated process, but we're trying to facilitate for that to happen in a cooperative sense.
Annalise, I know you heard from our reporter on the ground in Melbourne, Andrea Crothers, a bit earlier in the bulletin. As she was reporting, the focus is now on one particular residential facility, St Basil's. There are teams in place from a Commonwealth staff level. There's representatives from the Aged Care Commission there at the moment at St Basil's. The decision they'll be making today is whether or not they will move the residents impacted or if they will keep them there. What they're really tossing up here is whether or not the private hospital allocation is more appropriate. We know that wards have been freed up for aged care recipients, so they need to weigh up today if they have the services they need on the ground there at St Basil's to facilitate the level of care that they would get in a hospital, or if they do need to actually physically move residents on. But those numbers particularly worrying. No doubt we'll hear more on this front from our health authorities and from the Victorian authorities too. But with 63 aged care facilities now impacted in Victoria alone, it is a very worrying day for those aged care residents, for the staff members and of course family members who may be concerned about some of their older relatives inside some of these facilities.